Hello, it's Pandiculating Peter here with another of my techniques. And in fact, this one was sort of developed from an idea that I had when talking to a patient who was very anxious and stressed, particularly related to cannulation and needle phobia and needle anxiety. And she said that something that she did as the nurses were finding a vein, cannulating, etc., is that she would very gently just push her feet down on the ground, alternating between one foot and the other, just to pace out, if you like, the stress. So I call this technique the pacing it out technique. And so the idea is that you bring attention to your feet, combine it with breath, and then just pace out. So it's a sitting down technique. So they often are situations where you would rather not be somewhere, and in your mind's eye you can think about walking away or walking through a landscape, maybe walking around your garden, etc., to pace out any frustration, any anxiety and any fear. So I also teach this to students who are learning online. And the idea is that if they're feeding back on behalf of a group, if they've done a group activity, or maybe they're about to present some work that they've done for the course, and they might have a degree of sort of anxiety about performance. And of course, I always say to people that anxiety is a good thing, because it sort of gets you alert, gets you thinking, gets you sort of your heart going, and but it can be overwhelming at times. So it's the idea of pacing it out. And why we want to move our legs and feet is to dissipate that adrenaline and noradrenaline that we often associate with that drive to run away from a situation, or maybe to stand and fight, but we're not focusing on that. So I've got my handy little pair of feet here. And so I'm just going to go through it, just showing you what you need to think about doing with your feet. So when you're ready, then your feet might be close together as you're sitting. And the idea is if you just bring your feet shoulder width apart, so you've got a bit of room which to move. So the idea is that you bring your foot off the ground as you breathe in. And then as you breathe out, you very gently bring that foot back down to ground, down to ground. Breathe in normally, in and out as you, in between. You don't have to do this as a constant thing. It could be a paced thing that you do a breath in, breathe normally, then do it again. So we're going to go again. Breath in, lift the foot off the ground. So you're feeling the muscles in the back of the calves. And then as you breathe out, push that foot down to the ground, feeling your feet firmly on the ground. So we're going to move to the other foot. So breathe normally now in between. And then when you're ready to go, take a breath in and lift that foot off the ground. And then when you're ready to go, breathe it out and push the foot down. So the idea that it becomes walking. So we're breathing in, lifting off, and then breathing out and pushing down. You may want to take a moment in between just to breathe normally, and then when you're ready to go again, breathe in, lift the foot off, and then as you breathe out, push that foot down. So you're working the muscles of the calves and you're really dissipating the adrenaline, noradrenaline. Breath in, lift the foot off. And then as you breathe out, push that foot down to ground. So the idea is that it's grounding you. And just take maybe 10 of these just to pace it out. Or if you're going through a procedure, you could just be doing that and focusing in on the breath and the pushing of the feet in a walking motion, nice and gently. And in your mind's eye, you could be thinking about walking away from whatever procedure you're having done, with it being all done successfully, or maybe even take your mind's eye off to a favourite place that feels really comfortable. Maybe imagine with the sun on your face, maybe walking through a favourite garden. So that's called pacing it out. Good to do while you're maybe having a procedure in the upper body, or possibly to do if you're online. You don't want to see people noticing that you're feeling a little bit anxious, a bit concerned, and you're working out that frustration, that anxiety, very discreetly with your feet while you're engaged with the audience online and with your colleagues.